Well, is there anything else you want to add to our conversation today? It's been that we didn't cover. I mean, your office has great follow-up support. Oh, one other thing we didn't talk about is there a time of year that you would recommend having this done? We didn't talk about that.
That is a great question. Really, any time of year is fine for treatment,
Okay.
but I will say that because of the stocking use, a lot of our patients like to come in the cooler months. And I would say that after some treatments, depending on the treatments, there is a risk for having a temporary hyperpigmentation that stays on the skin, kind of that brown discoloration that we can get. It kind of looks like an old bruise, basically.
Okay.
And that's not for everybody, and it's not for every treatment, but some patients can get that. And if you do, we would ask you to avoid sun exposure in that time period.
Okay.
And
Okay.
that can linger for several months. So I have patients who, I mean, some patients don't get it at all. Some patients have it for a few weeks and it's gone. Some patients, they find it really lingers. And so we can't, expect that for everybody. Can't plan time of year. But we do know if you're about to go to the beach, we would rather do it after that, that kind of thing.
Right.
So,
Right.
but so for things like that, pant weather is a good time, to be
Okay.
inside. Or if you have an occupation or daily activities that you're mostly indoors, that can be summer can be just fine. But
Okay.
other times we do have a lot of patients who like to come fall, winter, early spring in those kind of cooler weather months. One thing we've not really talked about are complications of varicose vein disease. Um, and so let's just touch on that very briefly. So, in
Okay.
general, we think most of our patients who have varicose veins have the symptoms we already talked about, the aching, the swelling, the cramping, any of those symptoms.
Right.
But there are actually conditions that can happen after long-standing backward flow that can cause other things. So we actually will see patients who have skin damage from long-standing backward flow, long-standing inflammation of those varicose veins. So, some patients, they don't necessarily see varicose veins, but they have changes on their skin. And from a severe being like an ulcer, so if they have like non-healing wounds, that's a great reason to come check your veins because it could be that you have varicose veins that are preventing those wounds from closing. We have a lot of patients who are in wound care clinics and are, have these, it can be minor things that happen that causes an open wound and then it forms an ulcer and it's not infected, but it just won't close. And so those are patients we absolutely got to treat varicose veins with. But even before that, we have patients who will get different skin conditions that can kind of lead to that, and that can be anything from just kind of redness on the skin to a hardening of the skin. They can get kind of a brown discoloration. They actually talk about it as almost like a pirate like peg leg of it. They get these like skin retraction that
Yeah.
can happen. They actually, a lot of patients will come in thinking they're having swelling on one side, and it's because they're comparing their two legs, and it's not actually that they're having swelling. The one leg is normal, but they're seeing the skin retraction on the other leg and thinking that that is the normal leg. And so it does cause more severe damage. And so if you have skin changes like that, sometimes even, you can just even kind of see like skin flaking. It looks like dry skin, but no
Right.
matter how much lotion and, emollients you're putting on your skin, it's not getting better. That can be a sign even just as almost like a rash that happens with varicose vein disease. So those are all reasons that we would want to treat the veins. Again, I kind of tell patients that when you have varicose vein disease, it's typically an elective procedure. It's something that is bothersome, but it's not an emergency to treat. It's not something that you have to treat. You can live with aching and cramping if you really wanted to. It's not gonna be, it's not life or death. But when it comes to these skin changes, these ulcers, things like that, we would highly recommend treatment. It's still not life or death, but it's like we need to get this for your actual true health and healing and skin, protection basically. On the other side, another somewhat common complication of varicose vein disease is actually blood clots.
Yeah, I was going to mention that.
Yes. So, and what I still tell patients is that we don't treat just to prevent blood clots because varicose vein disease in general doubles your risk of having a blood clot. But that being said, if you don't already have reasons why you're at risk for having a blood clot, it's still a very low risk. So the average person who doesn't have, a genetic clotting disorder or something like that, just walking around living their normal life is about a 1 out of 10,000 chances for getting a blood clot. If
Okay,
you have varicose veins, as we said, it doubles your risk. That makes it a 1 out of 5,000 chance. But
right.
again, statistically, that's still extremely low. So it is a complication that can happen, but it's very rare. That being said, if you have gotten a blood clot and you have varicose veins, it definitely raises your risk of having a second blood clot. So that is another time that we absolutely recommend treating your veins. Again, we make sure that the deep vein system is functioning well. Not everybody needs to have them treated, but it's something to be evaluated to help lower your risk of having another clot in the future.
Right. Nurse Table Talk. On our channel, I've always been an advocate for being proactive with
Hmm.
our own health, paying attention to your body. If something doesn't look right or feel right, you get it checked,
Hmm.
and
Absolutely.
you can ward off other
Yes.
you can ward off other complications if you get treatment early for whatever that condition might be. But you have to listen to your body and pay attention.
Absolutely. Another thing I would kind of like to bring up and make sure people understand is that we can't cure these veins. It's not something that's a one and done treatment like having your gallbladder removed or something like that.
Right.
It is genetic and we have hundreds of veins and hundreds of valves. And so we can't, you know, cure it 100%. We can eliminate the veins that are failed at this moment, but it is very possible for it to come back. After treatment, I usually tell patients it's about an 8% recurrence rate at 5 years. It creeps up to about 15% by 10 years. We are specifically talking about varicose vein disease at this point. And so it's again not something that we can prevent it from coming back. If it's genetic, if it's going to come back, it's going to come back. But we just have to kind of know going in that it's something that we sometimes have to maintain. Now with treatment, we're hoping to give you several years where the symptoms are better, and then if they come back, we can treat it again. We're never going to run out of veins or run out if you're having symptoms, if you're having varicose veins, we can treat them, but we just have to know it's more of a long-term problem. Spider veins come back actually a lot faster than varicose veins. So, what I
Oh,
typically recommend for my spider vein patients is that after your initial treatment, which might be, depending on a patient, let's say 2 or 3 sessions, we would maybe ask you to come in maybe once a year and have kind of a single maintenance treatment done. Now, you don't have to do that. If you don't, then we'll just wait a few years and a lot will come back and we'll treat them again.
right,
But it
right,
is something that, it's kind of like getting the gray dyed in your hair. It works,
right.
but it wears off. We don't have to come every 6 weeks, but maybe once a year or so. Just kind of keep maintaining your good result.
Yeah. Maintenance
Um,
follow up.
Maintenance follow up. And that's especially, something that I think patients don't necessarily understand before they come in.
Right. And it's a good idea to have that because you've just had this work done and you want to keep everything
Yes,
working well and
absolutely.
looking good too.
Yes, that's right. You've done all the work. It might as well look good.
Yeah, absolutely.
One thing we were talking about some of the, what can we do to prevent our veins and for them from failing and becoming a varicose vein. And for the most part, there's really not a lot we can do if you have that genetics, you're prone to them. But one thing we do know is that weight does play a role. We'd never like to talk about that as physicians,
Yeah,
but for somebody who is, especially those patients who are, substantially overweight, it is true that losing the weight, especially abdominal weight. We know that that does put backward pressure on our veins. So just like the people who are standing all day long, that is putting extra pressure, extra backward flow. And so, it is something that we would recommend for people is to, when they can, I know that is so difficult, but
it It's
you
very
know,
hard.
is
Yeah.
to lose weight when it's possible, to be moving, our legs are, especially from our vein standpoint, our circulation standpoint, we really are meant to be moving, and that doesn't have to be anything crazy, but just getting out and walking is
It's
regularly can be great. I have
right.
patients who have significant varicose veins, and yet they don't have very many symptoms because they're so active. So it is definitely something, again, it doesn't really prevent it from happening, but it
Right.
helps control everything, in the meantime. And it helps really just with the symptoms, especially. So that's
Okay.
always going to be something that we recommend for people is kind of as everything, kind of
Yeah. Yeah.
regular, moderate exercise and weight loss when needed. I will say I actually have some patients who are extremely healthy, but let's say they're bodybuilders and they're doing, very heavy weights. They actually have the same problem. They can be putting so much extra pressure on their veins that they actually can open those veins up more or
Wow.
cause more varicose veins. We actually have
Wow.
patients who are bodybuilders who have varicose veins that their treatments don't last as long because they're putting all that backward pressure. We still close them down, but they kind of pop them back open. And so
Right.
those are things we have to consider that it does raise your recurrence rate if you are active like that, even though it's overall a good thing. Um,
Right. Right. No, and that's great for the public to know
mhm,
because people don't
absolutely.
realize it.
Right. And actually,
So,
that's one population that I actually think the Venus seal would be a great candidate for because it is a permanent implant. It's not something that we're just sealing and it opens back up.
right.
And so there are reasons why we tailor therapy, and that's one of them.
Dr. Clayton, is there any other vein disorders that your office treats that we didn't talk about today that maybe you'd like to share?
That's a great question. So, first things first, I would say, as far as vein issues, we do treat cosmetic veins in other areas just beyond the legs. So, legs are what we do most of the time, but patients do get unsightly veins in other places, and we treat those. And so, most regularly, I have patients who we treat veins on their hands. I have patients that we treat facial veins. And so, that can be a great just cosmetic resource for patients. Our hand veins, we know we have some patients. I am not one of these patients. I have very, kind of fat hands, but I have a lot of patients who are very veiny on their hands.
I
Exactly
I'm
like
a
that.
veiny. I'm
Yes.
a veiny.
Those veins are normal veins. They are not abnormal. And unfortunately, part of our aging process, we have our skin thins, the connective tissues in general thins in our entire body, but our hands is very visible and very obvious. And there are different things that you can do to treat those, but some patients are, obviously would like them to look better. So you either can get like fillers that actually kind of plumps the skin back up. I don't do those, but that is one option. Or we can actually do sclerotherapy and treat the veins in the hand. Now, these are normal veins, they're not abnormal, but we can treat those superficial veins and lessen the appearance. We can't usually make them go completely away like we can with a cosmetic spider vein on your leg, which is an abnormal vein. But we can make them substantially better. So we do actually have some photos on our website of some hands that we've treated. Just like the other veins, they can come back, but we can treat them again if we needed to. The facial veins
So
are, oh,
let
go
me
ahead.
interject on this. So let's say you do the hands. Does that affect your circulation? Will your hands get cold? Like if you're in a cold climate and you have your veins treated on the tops of your hands, how does the cold outside affect that?
That's a great question. And I would say that we do have two systems of veins in our hands, our deeper veins and our superficial veins, just like we do all over our body. And we're only
Okay.
talking about treating our superficial veins. I do have some patients who, will ask, it would affect your ability to have blood drawn from those veins or to get an IV in the vein, because those are the veins they typically use. The deeper veins are still there and normal and working fine. So the circulation itself is fine. But if you were somebody who, you had medical conditions where you needed a lot of IV sticks, that might not be a great idea for you. Um,
Okay.
so it's something you have to think about that kind of pros and cons. With facial veins are also a little harder or more complex maybe. If they're larger, kind of bluer veins, we have patients who have them on their forehead or here or kind of under their eyes. Those we can treat and make substantially smaller. I have a lot of patients who will come and will ask us about very fine telangiectasias around their nose or around their cheeks. A lot of patients like who have maybe rosacea, for example, and those veins are too fine to get a needle in. And so for
Okay.
those patients, a great alternative would be like a laser treatment or an IPL treatment. At my practice, I don't do that. Some vein practices have a laser to do that, but I usually would recommend patients to go to dermatology for those. And
Okay.
then I have patients who will ask, well, if we're going to do a laser on this, why would I not just do a laser on my leg veins, my spider veins? And I would say that compared to the veins on our face, right around our nose, those are so fine. The veins, even spider veins, smaller veins in our legs are much bigger. And so the
Right.
gold standard of treatment for our legs is still to do injections of sclerotherapy, where you might only need 2 or 3 treatments. And if you were to try to do a laser, you might need 8 or 10 treatments that would be substantially more expensive and actually much more painful as well. And so, great. The laser is great for our face. It is, you can do it, but it is not the gold standard on our legs.
And that would be considered more cosmetic as well,
Yes.
right?
Yes,
Okay.
ma'am.
Okay.
Absolutely. So then
Okay.
kind of other conditions that can be within our realm that are not necessarily vein treatments, but kind of the other half of phlebology or venous and lymphatic medicine is lymphedema. So I have a lot of patients who come to be evaluated for swelling. They don't see varicose veins on their legs. They don't know if they have varicose veins, but they have this swelling and they don't know where it's coming from. I personally do not treat lymphedema, but I have some steps in place to kind of get patients started and kind of direct you to the next steps. And so, what we would always do is do an ultrasound, just like we do for varicose veins, because you can, as we said before, have varicose veins that you just don't see looking at your legs that could be causing the swelling. But if we don't find any varicose veins and there are certain types of swelling that kind of make us think that it is more lymphedema, we can kind of direct you. So swelling is a complicated issue. Obviously,
Right.
people can just retain water and, from their primary care doctor, just need a diuretic. You can have too much weight. You can have too much salt in your diet. There's a
Right.
myriad of
Right.
issues that happen with swelling. But if you have
Right.
controlled all of those things, you're not taking medications that cause swelling, and you're left with kind of why am I having this swelling? It's a great thing to come be evaluated. With
Okay.
if you were to have there are 2 conditions actually. Lymphedema is the most common, and that's something that actually is actually extremely common in the population, whether it's just very mild. And lymphedema is something that we typically kind of deal with swelling for a long time in our lives, and it's until it becomes kind of more end stage where it's happening more and more frequently, or it's not going away. Maybe for years you had it, but if you elevated it went away, and so it was fine and you dealt with it. But so we see it late, where patients are coming in and they're now like, oh, my leg is 3 times as big as my other leg and I can't get my shoe on and I can't hardly walk. And we want to treat it well before that, because
Right.
with swelling, it's all about prevention, or at least treatment before it gets worse. If it gets to that point, it's very difficult to get it to come back. And so we'd much rather see patients sooner rather than later if they're having swelling.
Right.
And if we were to diagnose you with lymphedema, my recommendations are kind of threefold. First of all, compression is key. And there are different types of compression for patients who do have substantial edema, substantial swelling. For patients with varicose veins who maybe have a little swelling, but they're not, it's not horrible, a standard stocking works great. But for like my lymphedema patients, for example, they might have substantially different leg measurements at the beginning of the day than at the end of the day. And you
Right.
can't get a stocking to fit that. So there are different types of compression for people who have a lot of swelling that can help kind of squeeze some of that fluid, away from the foot to kind of help, against gravity. So that's number one, and that's something we would absolutely recommend. Number two, there are certain physical therapists who are certified and specialize in treating edema, treating lymphedema patients. At our clinic, we have a list of the ones that we know about in Knoxville, but that's something you can just Google as well. But that would be a great asset to treatment. And again, I don't do that, but I'll give you the list. But there are it's not just exercises. There are true kind of decompressive therapies that they'll use. They will give some at-home exercises to kind of help keep the fluid moving as well. So it's a combination, but it's
Right,
not just standard what we kind of think of as physical therapy. There is more to it that's
right,
specific for the swelling. And then the third option is there can be some actually like an air pump that a lot of the insurances will actually cover for you to have at your home that kind of again sort of just manually gently it's not painful. I've worn them, I've tried them, but they will just use an air kind of mechanism to kind of squeegee the fluid out of the legs,
right,
and that's something that you can do every day that can help. And so the real overall thing when we get lymphedema is not necessarily a cure, unfortunately, but it's management. It's to get it
right,
where we can make your quality of life better. And
right.
so I feel like I can help. I have some resources where I can kind of help direct patients in that. There are some patients who benefit from going to see like a plastic surgeon who can specialize in that, but unfortunately, we can't really fix the lymphatic system once it becomes compromised. So it's kind of just
Right.
dealing with the aftermath. And then I also actually have a subset of patients that are typically women that have swelling that is painful. So lymphedema is typically not painful. It can be a
Correct.
nuisance and be extremely aggravating, but it's not doesn't hurt to the touch. It's just a lot of swelling. But there's another group of people, as I said, women who have a similar condition called lipedema. And lipedema is a little bit different. It's a combination kind of everything. And they need some similar treatments, but there's also some differences as well. And so we can talk about that. But that's kind of one of the hallmarks is that it's typically painful swelling. Um,
Okay.
and we can kind of talk through that. So again, I don't treat those conditions, but I can help guide patients to therapies to try to make those better.
Well, that's good. You have the resources to share with
Yes.
people and kind of give them the guidance and the support to, send them to where they need to go. So that's great. Well, thanks again. And
Welcome.
if you want to be a guest in the future or you
Okay.
find that there's other things you want to talk about, please feel free. Let me know. We'd love to have you
Absolutely.
back.
Well, thank you.
Thank you.
Nurse Table Talk. Save time, save money, be informed. Thanks for watching.